Bismillahirrahmanirrahim. Assalamualaikum and good morning to our beloved lecturer Dr. Farhana Binti Sabri and our class members. Okay, today our group will present about a case study related to John Nash biography. Okay, before we start the presentation, I want to introduce my team members. Okay, the first presenter is me, Nur Abida binti Ayub. The second presenter is Mrs. Asma binti Ahmad, and the last presenter is Mrs. Nur Azlin binti Yusuf. This is our content overview. This is a case study about John Fabulous Nash Jr. He is one of the greatest thinkers in mathematics in the 20th century. Okay, he developed schizophrenia at the height of his career. Okay, for many years, Nash's schizophrenia devastated him professionally and personally. Nash was born on 13 June 1928 in Bluefield, West Virginia. His father, John Forbes Nash, was an electrical engineer, and his mother, Margaret Virginia Nash, had been a school teacher before she was married. Okay, John Nash and his wife died in an auto accident on 23 May 2050 at the age of 86. Okay, Nash served as a senior research mathematician at Princeton University. Okay, Nash married Alice in 1957 and has a son who was also named John. Okay, he attended Carnegie Institute of Technology through a full benefit of the George Westinghouse Scholarship. Initially, major in chemical engineering. Okay, after graduating in 1948, okay, which both Bachelor Science and Master Science in Mathematics. Okay, Nash accepted a scholarship to Princeton University, where he pursued further graduate study in mathematics and science. He was admitted to McLean Hospital in April 1959, and in 1961, Nash was admitted to New Jersey State Hospital at Trenton. This is a timeline of John Nash life. Okay, he born in 1928. In 1947, he experienced symptom of paranoid. In his 20s, 1954, he was arrested for identity with other men in a public laboratory. In 1958, Nash became increasing withdrawal, referential, and paranoid. His symptoms rapidly progress and include characteristic features of schizophrenia. In April of 1959, his wife committed John to McLean Hospital, a stately private psychiatric institute in the Boston area. At the time Nash was admitted, psychoanalysis was the primary treatment for schizophrenia at the McLean. In 1961, Nash was admitted to the New Jersey State Hospital at Trenton over the next 9 years. Okay, this is a story of presenting problem. Okay, in 1958, John Nash began to show sign of schizophrenia. Okay, he experienced 3 types of schizophrenia, which is paranoid schizophrenia, disorganized schizophrenia, and undifferentiated schizophrenia. Okay, the first sign when he would disappear without a warning and sometimes for a days and return without offer any explanation for his absence. Okay, the psychosis is presented as organized visual hallucination, delusion, and paranoid. Okay, Nash psychological issue cross into his professional life. Okay, over the next 9 years, he spent a period in a psychiatric hospital, which is McLean, and the New Jersey State Hospital at Trenton. Okay, that's all my presentation. Okay, the next slide will continue by Mrs. Asma. Okay, thank you. Assalamualaikum. Bye.
Thank you, Mrs. Abid. Assalamualaikum. to Dr. Farhana and my beloved friends, and good days to Mr. Pradeep and Mr. Kumar. Okay, I will explain about history of Nash, John Nash. Okay, first I will explain about family history. He was the son of an electrical engineer, John Charles Nash, and Major Virginia Martin, an English and Latin teacher. When Nash was 12, he was carrying out scientific experiments in his room. It was quite apparent at a young age that he did not like working with other people, preferring to do things alone. Johnny was always different. His parents knew he was different, and they also knew he was bright. He always wanted to do things his way. His father insists his sister to things for him. Okay, history about social relationship history. John Nash stays alone at University of Princeton, but he claims he had a roommate named Charles Hammond. John Nash had two best friends named Saul and Benja. His wife, Alicia Nash, encouraged by his wife, Alicia, Nash worked in a communication setting where his eccentricities were accepted in 1994. She always supported Nash to struggle with his schizophrenia until Nash win the Nobel Prize. His sister Martha, named Martha, is his friend in childhood. About his history in academic, in 1948, he graduated from Princeton University in mathematics. In 1950, he earned his PhD degree with a dissertation on non-cooperative games. 1950, in Anthem, he began to work seriously on pure mathematical problems. In 1951, Nash went to the Massachusetts Institute of Technology as a C.L.E, male instructor in the mathematics faculty. In medical history, John Nash got his treatment in a psychiatric hospital. He remained in and out of mental hospital until 1970. He was given insulin, shock therapy, and antipsychotic medication. After 1970, by his choice, he never took antipsychotic medication again. Counseling history, Dr. Roshan was monitoring John Nash during his treatment. Assessment and diagnosis. In these studies, Professor John Nash, a schizophrenia, a mathematical genius, and he got a Nobel Prize winner. John Nash was stated as a patient who suffered from schizophrenia. John Nash was suffering from schizophrenia right after second year. He got married with Alicia Lopez in February 1959. Okay, John Nash was suffering from three types of schizophrenia. First, he got paranoid schizophrenia, auditory hallucination, and visual hallucination. For example, in his case study, he can talk and see Charles Herman, William, Rachel, and Mercy. He claimed Charles Herman his roommate, but actually William Rachel, Charles Herman, John Nash hallucination. He claimed Charles he's nice, but it's just hallucination. His hallucination. The second diagnosis is about disorganized schizophrenia. His speech that is very disorganized, illogical, and hard to understand. For example, disorganized behavior of Nash when he's shaking hand to someone. He does not see people's face. Okay, the third type is about indifferent schizophrenia. He saw that he lack of interest in the world, social withdrawal. For example, Nash withdraws himself from people. He is unsociable man and rarely he finds himself interacting with people. When he is in university, he tells Charles has his friend, but Charles is his hallucination that he does not like others people and they do not like them too. Okay, from diagnosis this DSM-5, primary diagnosis is F20.9 schizophrenia with multiple episodes currently in full remission. Secondary diagnosis is F13.232 with sedative, hypnotic, and anxiolytic withdrawal with perceptual disturbance.
Okay, Assalamualaikum and a very good morning to Dr. Farhana and friends. Thank you ladies for the presentation just now. Let's continue with the treatment. For John Nash, he was hospitalized on 1959. He was given insulin shock therapy and began taking medicine antipsychotic. For insulin shock therapy, it was a treatment where they repeatedly injected the patient with the large doses of insulin in order to produce comas over several weeks. Okay, for the treatment of schizo patients, it begins on 1920s by introducing ECT. Later on 1950, they introduced the first generation of antipsychotic. And then for the 1980s, they produced the second generation of antipsychotic drugs. The R&D in antipsychotic drugs was continued in 1990s, and the latest one is on 2008, whereby they produced a typical antipsychotic, which also include azapenine and also paliperidone. Okay, the treatment for schizo patient involve three phases. Firstly is the acute phase to prevent harm. Secondly is stabilization phase to prevent relapse, and finally is the stable phase to maintain and improve the condition of the patients. Okay, here are the goals for the treatment. It is to minimize the symptom, minimize the side effect, prevent relapse, and maximize the function of recovery. Okay, for the other patients who was diagnosed for co-occurring disorder related to schizophrenia, we would like to recommend for the treatment of the integrated model of treatment. This treatment include pharmacotherapy, psychotherapy, ECT, family psychoeducation, psychosocial remedies, and also the treatment for the substance, especially drugs. Okay, firstly, the treatment is pharmacotherapy treatment by using antipsychotic drugs. The names of the drugs are such as below for the first generation and the second generation. Okay, the goals of pharmacotherapy is to optimize the therapeutic benefit. It is also to educate the patient about the side effect, and finally is to improve the reporting short-term side effect. Okay, the tables below show the minimum and maximum doses of antipsychotic drugs for the treatment schizophrenia and other mental illness in UK. I think that's not much different in Malaysia. However, antipsychotic drugs also produce several side effects such as orthostatic hypotension, extrapyramidal effect, hypoglycemia, sedative, anticholinergic, and also weight gain. The seriousness level of the side effect is according to the table in between.
Okay, the second treatment is ECT, which is a short form for electroconvulsive therapies. The procedure is sending a small electric to brains, generally when the patient is under anesthesia.
Okay, the third treatment we suggest is psychotherapy. Like other treatment for the other mental health and mood disorder, pharmacotherapy also help patients with schizophrenia. like CBT and motivational interview. The purpose is to help the patient to develop a better social and problem-solving skills. Okay, another treatment we would like to suggest is treat the co-occurring issue related to drugs or substance. We must be able to identify, coordinate treatment and treat the patient with their tolerance or withdrawal. It is important to help them to navigate life, improve compliance and reduce stress along the process of recovery. The keynote here is antipsychotic do not cure schizophrenia. It treat same way as insulin treat diabetes, whereby the drug cannot be stopped immediately because it may develop tolerance or withdrawal. For the family psychoeducation and psychosocial remedial therapies, both are important for the long-term recovery process on the patient. Okay, the prognosis for the case of John Nash, he is extraordinary and quite different compared to other schizo patients. At first, he get treatment insulin shock therapy and medicine antipsychotic. After a few times, he stopped the treatment and have hallucination symptom again. He continued the treatment again and slowly recovered in a natural way. He had fully recovered schizophrenia by 1970s and he became very successful in his career. Among the contribution to this is his family and environment at the Princeton University. However, he had a son who also inherited both of his intelligence and the schizophrenia disorder. Okay, usually the prognosis for the schizophrenia patients is according to the rules of third. 1/3 is good, have a good living, independent living. 1/3 is intermediate, have a semi-independent living, which extra support. And 1/3 is poor, who has little or no remission. Okay, the relevant ethical and legal consideration for the schizophrenia treatment are firstly the consent volunteer from the patient himself, and another thing is about the planned treatment should involve the family or the important person in the patient life. Okay, here are the several instruments that can be used to measure the condition of the patient. Firstly is the psychological test, DAS-21 item. Secondly is the positive and negative syndrome scale, PNSS. Thirdly is behavior rating inventory for executive function, and finally is the cognitive failure questionnaires. Finally, I think that's all from me and that's all from our group today. Thank you, Dr. Farhana and friend, for your kindly attention. The good is from Allah and the lack is, of course, surely from us. Thank you very much. Assalamualaikum.